today we are talking on the eve of World Heart Day, and the biggest problem which is facing the world health problem is the heart issues. So today we'll spend some time to understand what is this health of the heart, what are the risk factors which are actually impeding the health of the heart, and how we can prevent them. This is myself as an internee medical officer in 1971 when there was a Bangladesh Liberation War was going on. So at that time, I had to leave my internship in King George Hospital and then proceed to join the army. At the King George Hospital via Visakhapatnam, what we had was two types of wards. One was a general ward and the other was a special ward. The general ward patients always had diarrhea, malaria, filaria, etc. Whereas the special class ward always had hypertension, diabetes, and heart disease or heart attacks. Somehow, these two groups never seem to mix in the sense that the poor people didn't seem to be having heart issues and vice versa. So, whereas today, in 2023, when I'm in the cardiology department of Apollo Hospital, what we see is there's no difference. We have auto drivers just eating 2-3 meals here and there, they are having heart attacks. High school children and just people just passing out of college having heart attacks. So a lot has changed. What we wanted to see is the incidence of heart disease really increasing? What causes heart disease? How can we prevent it in our society and our homes? What is heart attack? And how do you revive a person whose heart has stopped? So this is a pictorial depiction of the heart, the cut section. Inside is all hollow, as you can see. Now there are two sides. The blue side is called the venous side. That means impure blood is here. And on the left side, you can see my pointer. This is the left side of the heart containing the pure blood, that's a different color. Now on the right side, we got two upper chambers that we call atria, right atrium, right ventricle. On the left side, we got upper chamber, left atrium, and this is the left ventricle. These upper chambers are receiving blood from the body or from the lungs, and lower chambers actually deliver this to the various parts of the body. Now, to activate this particular sequence of events, God has kept a small transformer inside the right atrium at the top. This is called the sinoatrial node. It is like an automatic switching mechanism. Every minute, 70 times to 100 times a minute, it keeps on pulses. And these pulses are being delivered to the heart, which go by specialized nerves hidden inside the heart, like the hidden wiring inside the house. And they activate in sequence. First, they have to activate the upper chamber, then they have to activate the lower chamber. Again, upper chamber, lower chamber. So the heart keeps on pumping. Now, this is supposed to be the most wonderful pump ever made in the universe, in the sense that is guaranteed for 100 years, unless something goes wrong, of course. So this is an electrical force which starts from the right atrium and goes on towards the apex of the heart and thus pumps the blood. And to keep this heart going, the beautiful piping system is provided by God in the heart muscle itself. Hidden partly are the arteries. Now these are the arteries which supply nutrition, glucose, and various metabolites so that the heart can keep on working, whether you are awake or asleep or you are running or not. It keeps on adjusting its blood flow and keep on pumping forever and ever. It's a beautiful system. And you can see this, the LM means left main disease, left main coronary artery, which divides into one artery going forward, it's called LAD, and one going backwards, called circumflex. So this is what we see. And this is a picture of our arteries, the cut section. Then the bottommost on where I'm going my pointer, this is our arteries, how they are when we are born or when we are young. But very soon, the second picture you can see, small flecks of yellow colored fat starts getting deposited under the tunica intima. And by middle age, you find that these fatty streaks keep on coalescing and form a fatty layer. And by the time you are old, the fat and cholesterol keep on encroaching onto the actual lumen. So you can see what a fine uh, vessel, it was pipe, and now it's been reduced to a small chink. Now this can be at one particular place or the whole length of place, and this is the biggest problem of all. Now, if you open this particular area which is blocked, you can see the dirty lining here, and this is like a putty material. This is all cholesterol which is jamming the actual passage. It is like the tunnel which is being closed from both sides, and this is the normal lumen. And here you can see the hardly there is any blood place for the blood to flow. Now, this particular thing can happen anywhere in the path of the artery and thus cause havoc. Now, this is a cut section of the artery that we always teach our students. Outside, there's a layer called adventitia. Then there's a muscular layer which keeps on helping the arteries to pulsate, tunica media. And there's an inner layer which is called intima. Now, between the lumen and the intima, there is a layer where the cholesterol suddenly likes to get accumulated under this area. And that is the biggest problem of today. Now, when such people who have got cardiac problems, with chest pain, heart symptoms, they go to the doctor, they do angiogram. And here is an angiographic picture of a live patient. We got the left vein artery and the right circumflex arteries here. And he can see here the artery on the left side. This suddenly there's a break. The black one is normal, and suddenly there's a break. That is where there's a clot sitting. The clot is made of cholesterol as well as the blood cells. Now here is on the right side. Can you see the arrow pointer? The big artery, which is lovely artery, which is suddenly choked by a chunk of cholesterol sitting right in the middle, blocking the whole road. Now, this particular stenosis, we call it coronary stenosis, can occur anywhere, like left side, right side. You can see so many examples of arterial narrowing. Now, this is the biggest problem of this particular era. We really do not know what is causing it, why some people have it and some people do not have it. The entire medical community is trying to do research. As you can see, they are trying to do some scraping and try to find out what is cholesterol, where does it come from. They're trying to clean it up, and they're injecting something here, and they're examining and various reports and their medications. They're being pumped inside to prevent the cholesterol from expanding as well as from the clot to be forming. Supposing their artery is totally blocked, then what happens is that particular area of the heart undergoes what is known as a infarction. This is called heart attack. When you hear somebody say, my father had a heart attack, it means his arteries got blocked and one particular area is totally dead. It is not the entire heart, because there are multiple arteries. One artery gets blocked, this is seen. If 2-3 arteries get blocked, maybe there will be multiple areas. Now this area is called like a wound, and this center portion is totally dead, and the second portion also is going to die soon because it's not getting proper blood supply. And in the periphery, there's one more zone which is on the borderline. Now these are the ones which cause pain and various troubles. So when the patient goes to the cardiologist and he identifies the block, we have got some measures. Either we give medicines, but sometimes we give injections of clot busters. Now these clot busters, when they are injected, like tenecteplase, streptokinase, various medicines are there. They try to dissolve the block artery here. So if the patient comes very fast to the doctor, we can run a glucose drip with that medicine and the clot clears away. But it does not clear the wall which is narrowed. So after the clot clears away, the doctors have to pass a catheter and through the catheter put a balloon and widen the artery lumen and then leave a stent. Now, on the extreme right side where I'm showing, this is called a stent, which is a micro filter sort of thing in the wall, like a hollow cylinder. From the front center, the blood can flow, and on the other side, it is holding the artery from collapsing. So this is called balloon angioplasty, and this is called the stent. Now these stents have over the years have evolved from a simple stent to advanced stent to very drug-coated stents, and there are some which actually dissolve inside. So various medical progress has been made. Now supposing there are too many blocks, then the patient goes for a bypass surgery. You will have heard so many people, no, this patient is not fit for a balloon dilatation. He has to go for a bypass surgery. Here you can see the patient has got big blocks, and they cannot be ballooned out or any stented. So the patient has gone for a bypass. Now, what is bypass? Supposing the road is blocked, they build a flyover. So something like this, a flyover is built here. This is the vein, blue colored vein, taken from the patient's leg, from the aorta right into the artery which is blocked. And there is on the left side, now this is a red colored stepney sort of thing here. This is the artery which is already hanging loose in the chest, which has got not much of a work to do. That has been attached to the lower end. So this is called arterial graft, which is a superior graft. So these are techniques are called bypass surgery, coronary bypass surgery. So this is the venous graft, and this is a arterial graft. All types can be used. Now the surgeons can do either single graft, or they can have one venous graft, an arterial graft, or they can have various sequential graft, triple graft, and sometimes quadruple graft when there are multiple blocks up there. But they're all expensive and cumbersome. They take time, and they also sometimes risky. So this is the era of treatment of coronary artery disease by medicines or the stenting or bypass graft. But what exactly has caused it? Can't we stop at the source? So is it a heredity that is causing it, or is it a habit that has patients have picked up, like bad habits like smoking, excessive alcohol, lack of exercise, obesity, like increased stress, or something to do with the food, something to do with cooking oil, or is there something else? Is it something to do with the viruses that are nowadays going all around the world? Or the question mark is it something to do with the vaccines that have been used? So when patients come and say, doctor, is there something wrong with my food? Why did I get this block? I say, please answer my questions first. How many members are there in the family? What cooking oil do you use in the kitchen? How much oil do you buy in 1 month? How often do you eat outside food? So these are the questions. Why are they asked? They're basically, the World Health Organization has said that consumption of oil should be limited to 500 ml per head per month. Supposing there are 4 people in the house, the consumption should be 2 liters per month. Supposing the guests, okay, add 500 ml. And secondly, the oils become bad when you keep on reheating them. In our homes, we use cooking oil once, and the evening we discard it. But there are many other outside agencies which you keep on heating the oil. You know that there are a lot of these small little stalls on the roadside, vendors, they're called Bandi sort of stalls, or they keep on baking or making a frying interesting stuff. They can maybe samosas or something else, some omelette, which will be hot and very tasty. So people do stop there and have a quick snack there. But where are these people getting the oil from? These people are buying oil from the hotels which have used the oil all day. In the evening, when they are about to throw them out, these people buy them. And then they're again fried from next day morning to next day evening. So these are highly fried fruits which have really become rancid, very thick in cholesterol. And now you enjoy the lovely taste, but you come home, the cholesterol does havoc to your system. So what we should do is eat outside food less, reduce the party cooking, and maybe maximum once a week, and avoid roadside, we call Bandi food. Now, nowadays, everyone is testing cholesterol, because cholesterol is ultimately the culprit which goes and gets lined up in the arteries. Now, total cholesterol, as you can see, the borderlines, it should be around 200. Ideally, everyone's cholesterol should be less than 200. Earlier, we are only measuring the cholesterol. Nowadays, we got so many variants. Cholesterol is not one particular molecule. We got combinations of high density, low density, triglycerides, etc., etc. Out of which, the high density cholesterol is our friend. It's good. Where LDL cholesterol is the villain of the piece. And triglycerides are the villain's helper, you can say. So when the patients come to me and ask me, how do you remember which is bad cholesterol, which is good cholesterol? I ask them simply, do you have seen the picture Sholay? In the picture Sholay, who is the hero? Amitabh Bachchan. Yeah. HDL cholesterol is Amitabh Bachchan. The more HDL cholesterol, the more safe. And who is the villain? Gabbar Singh. So LDL cholesterol is equal to Gabbar Singh. So control this villain and things will be okay. And who is this triglycerides? Triglycerides are the chamcha of Gabbar Singh. That is a guy is called Samba. So this is the way I teach them so that they don't get alarmed. Sir, my triglycerides are 800. I said, relax. If the LDL cholesterol is low, the triglycerides cannot do a thing to you. Okay. So this is to tell the patient very clearly, watch your cholesterol profile and try to improve HDL cholesterol. Now, this is the lipid metabolism. Where is this cholesterol come from? It has come from the food. On the extreme top right, you can see small intestine, what you eaten gets inside, and they get attached to things called chylomicrons. Now, these chylomicrons are the, I have to use a lot of pseudonyms to keep the patient understand. I said they are like your Uber or Ola taxi outside the railway station waiting. Wherever the cholesterol wants to go, it will take you. So the cholesterol latches on to chylomicron and says, please take me to the liver. So here it goes into the liver. And once into the liver, it enters and goes on again, modified, and ultimately it makes a lot of interesting stuff. All the hormones of the body are made out of cholesterol, right? All the estrogens, androgens, everything. Cholesterol is important for the structure of the body. But the excess cholesterol now keeps on roaming around outside, and then it goes into the adipose tissue. You get a big tummy, or it goes to the muscle. Muscles become weak. So HDL becomes less and less. The high density cholesterol, which is supposed to be good, that becomes less. So this is what is our lipid profile, desirable. HDL cholesterol, the hero, should be 40 to 60. We should increase as much as possible. If you do the LDL cholesterol, it will be 70 to 130. The lesser the LDL cholesterol, the better life would be. And triglycerides, around 10 to 150, really, I won't bother about them. Triglycerides, if they are high, we suspect that the patient has got a hidden diabetes or hypothyroidism or is got excess of alcohol intake. So this is our aim. People say, sir, in that case, why don't you give me an injection of HDL cholesterol or give me tablets of HDL cholesterol? Unfortunately, HDL cholesterol cannot be administered outside. You have to earn it. How do you earn it? By exercise. Regular exercise increases the HDL cholesterol. Eating sprouts will increase HDL cholesterol. And this is the way we have to increase HDL. LDL cholesterol, as I told you, the less oily foods, the better it is. So some people say, doc, we eat the same food, the same use oil in the family. Why is it only me who had the blockage? My brother hasn't got it. So we tell them this process of atherosclerosis or hardening of the arteries is a complex process of interaction of cholesterol plus the inflammatory response it generates in the artery where it enters. When cholesterol tries to enter the artery to line it, there is a vehement opposition by the various cells. In the big fight that ensues, sometimes cholesterol wins, sometimes the cells win. So this is your end product of the battle in your arteries. Now coming to oils. Earlier we were all using traditional oils for Indian cooking. The dabbawala used to come and then knock on our door and say, okay, give me 1 liter, 2 liters. Only we should take that oil and use it. Nowadays, of course, things have changed. You buy packets or you buy bottles. Now there's so many other oils like this: palm oil, sunflower oil, coconut oil. Okay, these are oils which are very, very good. Now the refined oils are not good. So what researchers have found was these are sort of cold pressed oils are superior in the sense that they lower the bad cholesterol, increase the HDL cholesterol, and also reduce the property of the red blood cells to unnecessarily make clots. So out of all this thing, the rice bran oil seems to be slightly winning over other oils. All oils which are cold pressed oils are good, but rice bran oil nowadays is very, very popular. So what we tell the patient is, you don't have to stick to one oil. For a month or so, use one oil. Next, you switch on to another oil, and then you switch on to the other oil. So get variety of oils in your 1 month or 2 months, and change them so that you get the benefit of all the oils. Now, this is the data which I presented about cardiac arrest. Now, people have said, now what update? Already pictures I shown, they are of heart attack, blockage. But all the patients whose artery get blocked, they don't die. They don't have sudden cardiac arrest. What is sudden cardiac arrest? Sudden cardiac arrest is a sudden stoppage of cardiac activity so that the victim becomes unresponsive with no normal breathing and no signs of circulation. Suddenly, everything stops, breathing stops, pulse disappears, circulation stops, he faints immediately. That is abrupt event, and this is very, very important. If corrective measures are not taken rapidly, this condition progresses to sudden death. Cardiac arrest should be used to signify an event as described above, that is reversed usually by CPR, means cardiopulmonary resuscitation, or by fibrillation, that is electric shock, or cardioversion, or cardiac pacing. Then that this called cardiac arrest is revived from cardiac arrest. So we'll see how a cardiac arrest patient whose heart is totally stopped, how long does it give time, and how fast we can reverse it. So what is cardiac arrest? Is it the same as heart attack? No. Heart attack is due to blockage of one particular artery. Now God has given you three arteries. All three will not block in one day or one moment. So if there is a one blockage, you will get a heart attack, and quickly, of course, you go to doctor urgently and make it all right and come back. So when there is cardiac arrest, that means all the neurological activity is stopped, heart has stopped beating, and that is cardiac arrest. We'll learn more about it. There is one more term called heart failure. People say, sir, my uncle has got heart failure, I want casually for 7 days. Now, what is this heart failure? Heart failure is the failure of the cardiac pump. So that slowly, the heart loses its function of pumping good blood and receiving bad blood back for purification. Slowly, the patient develops swelling of the legs, swelling of the face, and become bloated up. He cannot walk, he becomes very breathless. So again, we are coming back to this sudden cardiac death. We have heard of sudden cardiac arrest. Now, what is sudden cardiac death? Now, in the World Health Organization, they say a person who is otherwise not expected to die suddenly loses consciousness and dies within 1 hour. You hear sometimes a person falls down and nothing can save him. Within 1 hour, he's gone. This is known as a sudden cardiac death. Heart attack is different, and sudden cardiac arrest is different, and cardiac death is this. This is most probably a neurological problem that has happened. So, myocardial infarction, again, I told you same thing, commonly known as heart attack, sudden stoppage of blood flow to the heart muscle. It may be a minor attack or a major attack. It may lead to a cardiac arrest if it's large. Now, what is heart failure? Same thing. Muscle of the heart is damaged so much that it starts to fail, leading to BP and fluid collection. Sudden death is a big problem for the world. There are almost 7 lakh deaths annually. The average age in our country is about 62 years, and 10% of all the deaths in our country are sudden cardiac deaths. Now, here is an example of our president one day collapsing on the stage, and people are helping him. Now, who are at risk for sudden cardiac death? Definitely those who got the pumping problem of the heart affected by the heart disease. So there's a ejection fraction. What do you mean by ejection fraction? How much blood can the heart pump in one particular beat? And if the heartbeat is 50% and above, it's normal. If it's anything low, it's a low ejection fraction. These are the people suddenly, when they're asked to climb the steps or suddenly jump from one place to another place, they have a cardiac arrest. Previous heart attack, again, one more commonest cause. Sometimes cardiac arrest in absolutely normal people. These are the people with background of diabetes, hypertension, smoking, who don't even know that they have got. And there is sudden death with no premonition. Sudden cardiac arrest may be the first manifestation of heart attack in some individual. What are the other causes of sudden cardiac arrest? People who drown because of lack of oxygen, suddenly the heart stops. Electric shock, so many gadgets are being used. So sudden electric shock or lightning can cause the sudden cardiac arrest. Now, respiratory arrest, smoke inhalation, drug overdose, all of them can cause. The smoke inhalation, sometimes we hear during burns or fires because the patient has survived the burn, but he dies because of the cardiac arrest. Drug overdoses, severe allergic reaction, including bee stings or scorpion stings, everything can cause sudden cardiac arrest. And the most bad death is which occurs in young and fit people who go to play games and competition and suddenly they die. Now, here is a common event in many of the cities. A man who is all dressed up to go to work, suddenly has collapsed. And look at the people, they are not attending to him. They're all standing around and watching him. What has happened? Not one of them is immediately jumping and trying to help him. This is where valuable time is lost. So, sudden cardiac arrest is apparently normal person suddenly feels dizzy, loses consciousness, and lies limp with no activity, not moving, stop breathing, and there's no pulse. This is called sudden cardiac arrest. In 1 year alone, 7 lakhs in our country die from cardiac arrest. This is some big number, isn't it? Globally, all over the world, cardiac arrest claims more lives than colorectal cancer, breast cancer, prostate cancer, influenza, pneumonia, auto accidents, HIV infection, firearms, and house fire, all combined together. Still, they are less than 7 lakhs dying from cardiac arrest. Again, causes of the cardiac arrest, one more time. It could be ischemia, hypertension, viral infections, COVID myocarditis. There was a big threat when patients were recovered from COVID and went home, they suddenly used to die. We wonder what has happened. It's the COVID has caused myocarditis, which has caused cardiac arrest. And now we hear something else. In the US, a lot of people who have been vaccinated are now dying. And people suspect that it's the membrane RNA, mRNA related vaccines, which are the cause. Still, a lot of investigations are going on and a lot of allegations are being made to one another. We really do not know. We have to be careful. Inappropriate exercise. What do I mean by inappropriate exercise? Either people don't even walk, or suddenly one day this boy decides to become absolutely champion. He wants to become Mr. India. He says, I joined the gym and paid money, and suddenly in 2 days' time, he wants to lift 50 to 100 kg weight. And this is called inappropriate exercise. The exercise has to be gradually built up, your muscle mass, your energy capacity. Suddenly, if you one day you jump into big exercise, you will not survive. And same thing with congenital heart disease, hypertrophic cardiomyopathy, drugs, alcohol, all of them can cause sudden cardiac death. Now, what happens during sudden cardiac death? Here, as I told you, there's a pacemaker and various conducting system. Something goes wrong with the pacemaker. Instead of giving regular impulses, it gives rise to erratic activity. Now, in a classroom, there should be one teacher and many students, but only teacher speaks and all other students should keep quiet. They also can speak, but all of them cannot speak together. Similarly, in our heart, though this is the pacemaker on the right side, there are so many foci which are capable of, in case the teacher fails, somebody else can come and take an attendance, can mind the class, and somebody else, even if the monitor doesn't come, somebody else can take. So there is a backup for transformers all over the heart. But what happens is when the thing fails, all of them start acting together, and there is a chaos in the heart. Now this is the normal ECG. We call it the PQRST, named after the first positive wave, second wave positive wave, that PQRST. Each P wave is a atria contracting. QRS means the ventricles are following suit. So every P must followed by a QRS. P followed by QRS. This is the normal routine. So this is the way the P starts here and QRS occurs here. This is the same picture. And it is the same example. You see the ECG, the small little knot is the P followed by narrow QRS. The healthy, normal complex should look like this. Sometimes there are some rebel pacemakers. They start firing on their own. When without any P, they start making noise. It's like some boys in the class making noise. Okay, they'll maybe quieten down, everything all right. But if they start totally dominating the whole classroom, the heart is beating very erratically and very fast. Here almost 300 times per minute. And there's all chaos. They absolutely breakdown of the structure of the heart, the pumping of the heart, and the patient falls down due to cardiac arrest. So this is called fibrillation. Now here is again, patient has a heart attack, and soon after the heart attack, the heart goes into erratic activity. So complicated acute myocardial infarction. This arrhythmia, cardiac arrhythmia, lead to cardiac arrest. So again, the erratic activity in ECG leading to cardiac arrest. There is a big scar which forms in the heart due to heart attack. So if you say the picture, so this is a big scar, And this particular scar is the responsible for giving unnecessary impulses all over the heart. So how can he survive this? First, you have to have early access quickly. Somebody should take him and do early cardiopulmonary resuscitation by pumping his heart artificially till again the sinus node becomes active. And or if the too many pacemakers in the heart are talking at the same time, then we give a shock therapy. That's it, early defibrillation. Outside, I'll show you the pictures. A shock is given, and then the patient becomes all right. So then cardiac life support, and afterwards they have to be put in the ICU, and resuscitation, breathing, everything has to be taken care of. So this is a chain of survival. Now here's a picture of a long old picture of my textbook saying person has collapsed and his heart is not acting. So the two people are giving the cardiopulmonary resuscitation. One is giving the external cardiac massage, and one person is giving the mouth-to-mouth breathing. Of course, now mouth-to-mouth breathing has stopped being included in the CPR because of the various respiratory infections being transmitted. And secondly, they said that there is enough oxygen left in the heart. So for at least 5-10 minutes, if you keep on let the oxygen reach the brain by cardiac pumping, then the patient will live. So this is the cross section of the center, the chest, back, the spine, and this is the sternum breastbone, and the heart is compressed vertically. Now this is the patient who has gone to ventricular fibrillation, and after CPR, he might live. What is CPR? It means cardiopulmonary resuscitation. You are resuscitating the heart also, and at the same time, because of the pumping action, some air is going in and out of the lungs, and that the patient can survive. So there are two types of CPR. One is the immediate CPR. They are called basic CPR. And second thing is after patient reaches the hospital, it's called advanced CPR, where a lot of specialists are there. They put a trachea, and tube, put oxygen, and then patient is connect a pacemaker. So many things can happen. So what is done at the bedside is called basic CPR. It's an emergency life-saving procedure. It is an emergency procedure where when the heart stops beating, immediate CPR can double or triple the chances of survival. You've seen the picture earlier where everybody is looking at him rather than acting. At least one of them could have gone forward and tried to do CPR. The patient would have survived. Now here's a picture. This is a dummy patient. The patient is lying down, and the doctor or the bystander has come. Nowadays we got a new machine which is connected to the chest, and it will check for the rhythm. And if there's no cardiac activity, it will say, "Come, give shock." It will tell you, and then you push the button, and automatic shock is delivered. See, this is the machine, automatic pace, the defibrillator, and it will read the patient's heart and say there is no normal activity, so time to give a shock. 200 joules of current is thrown into the heart, and suddenly the heart starts beating again. So this is where in hospital we have got a drill. Supposing in hospital, like medical ward, surgical ward, somebody falls down with a cardiac arrest, and people immediately tell the exchange there's a patient of cardiac arrest, and all over the public alarm system, code blue, code blue, code blue, it's announced, and everybody who should leave whatever they're doing, all doctors, nurses should run to the nearest place where the code blue is announced and try to help in give an injection or do cardiopulmonary resuscitation, maybe start oxygen, and maybe give a DC shock. So within rapidly, the patient heart should be revived. Bystander CPR, that means if anybody trained in the bus stand, railway station, can also give a CPR. The location of out of the hospital cardiac arrest most often occurs in homes, residences 70%, public settings 18%, and nursing homes 11%. If performed immediately, CPR can double or triple the patient's survival from an out of hospital cardiac arrest. Now this is a graph which is showing how the percentage of survival. See, this is a 10-minute chart. I call it 10 minutes to heaven. If the patient's cardiac arrest is at 0, within cardiac CPR started here, the patient has got this much chance. And as each minute goes by, within 10 minutes, the patient is here not anymore. His brain is dead because without oxygen, the patient goes into a cerebral death, and that means he cannot be revived anymore, even if you do anything. So the brain damage occurs within 4 to 6 minutes after the heart stoppage. That means for 4 to 6 minutes, still there is patient's own oxygen will carry on, but afterwards it goes to bad thing. And after 8 to 10 minutes, there was irreversible brain damage. Even the patient's heart rate may come back, but the patient becomes a vegetable. For months together, he might live without any signs of visible activity. So he becomes a vegetable. So the survival rates, if no CPR performed, 0 to 2% survive. Early cardiopulmonary resuscitation or delayed defibrillation, 2 to 8%. Early cardiopulmonary and early defibrillation, 20% survival. And if the early CPR, defibrillation, as well as advanced cardiac life support, 1/3 of the patient can be saved. Is it possible in a country like ours, where even if you fall down from a cycle, nobody is there to lift you? But look at this Seattle in US, the city of Seattle and King County have trained all their citizens and all their bus drivers and everybody in CPR, and they've got positioned various places the defibrillator machine. And see, from 2002 to 2013, the percentage saved from 26% of lives saved to around 62% of the lives have been saved from a cardiac arrest. There's something. So if you don't do anything, patients' chance of survival of 5%. If you at least do the CPR, 9% of people survive. And if you apply an external device, a shocking device, external defibrillator, then 24% at least will survive. So each of you will say, why me? Supposing you see somebody lying on the roadside, people turn their face and go away. Unless I don't want to get stuck, I got my appointments. So homes, malls, airports, people will turn away. They don't want to get involved in the resuscitation. To call a doctor and ambulance, it will be too late, and maybe patient may be alive but brain may be dead. So every family should learn to have at least one savior to at least save the lives of people in our neighborhood or in a school where there are likely victims. So in this program, we are going to show you what is CPR, how to do it properly, whom to do it, and if you have an automatic defibrillator, how to use it. So let us watch a short video of the cardiopulmonary resuscitation by Dr. Satish, who is a critical care specialist in our hospital.
Good evening all. I'm Dr. Satish. Today I'm going to demonstrate the cardiopulmonary resuscitation. The importance of this topic is, nowadays we are hearing that many healthy people, while doing the gym or by traveling, we feel that we are looking in the newspapers like sudden death is happening. The most common cause of sudden death is acute myocardial infarction. So as a bystander, as somebody who is standing besides that patient, need not be a doctor, need not be a healthcare person. So after this video, if you can watch this, you are a saver for such patients. Like, I will demonstrate you how best you can save such patients. I come across a patient who is unresponsive here. So first check the responsiveness of the patient. How to check the responsiveness? Point 1. I have to ask him, hello, hello, how are you, sir? Can you hear me? Hello? No, he is not responsive. So my next step is, I have to check his carotid pulse, that is the major pulse, which is next to my throat. So if I keep my fingers here, just check for 10 seconds. If I'm not able to feel the pulse, yes. Now I have to start the chest compressions. The chest compressions, sir, I have to use my both hands, one hand over the other, and it is the line between two nipples and the central line. So you can, if you draw two lines like joining the nipples and there is central line, there is a plus happens. That is the place I have to keep my heel of my any of my dominant hand. Next is I have to add my next hand over that and come straight onto the patient. Like my hands are straight here. I'm not doing any angle here. I'm on exactly on the patient. Now I have to do compressions like 1, 2, 3, 4, 5, 6, 7, 8. We have to do these compressions at the rate of 100 times per minute. They should not be bent here and they should not be pulchronized here. Only movement should come from the hip. See, I am again demonstrating. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 20, 24, 25, 26, 27, 28, 29, 30. So this is how we have to do 100 times per minute the speed, and every compression should be 5 centimeters or at least half of the AP diameter of the chest. So I have to go at least half the AP diameter or minimum 5 centimeters. 1, 2, 3, 4. So this is the effective CPR. Thank you.
So the points that you have noted are: number one, the patient has to be on a hard surface. You cannot do a CPR on a sofa or a mattress or in a car seat. Patient has to be on a hard surface, lying with the face up, and then you have to check whether is conscious, unconscious, able to answer. Then you check the carotid pulse, and then you start the cardiopulmonary resuscitation by external chest compression. And you have to keep on doing. After every 2 minutes, you break for a minute, and again you break. You continue. It's a very tiring thing. But if a couple of people are there, one after another, they can carry on and carry on till the patient gets revived or the ambulance arrives. Now we have trained all the ambulance drivers, our ambulance staff to learn CPR, and thus once he's in the machine, the ambulance, he can get a shock, and then that will revive the health. So you can save a precious life by your action. I hope this talk has been helpful to you. Hope you read more about it and go and see a demonstration, and one day you also can save a life. Thank you so much, and I'm ready to face any questions. Thank you.
So the first question that we have received, sir, is there any difference in the incidence of heart attacks between men and women?
Yes, the good question. We have been noting from the beginning, and also it is written in the books that there is a difference in the two sexes. Females have got less of incidence of heart disease, and men have got it is more of incidence. One of the reasons is that it is due to the protective effect of the estrogens in the body. That's why a woman who between the age of menarche and menopause, she's protected from the deposition of cholesterol, the excessive clotting, all these things are protected. And maybe afterwards, the incidence becomes same. Maybe in one way that nature also understands that the woman's importance, and then how the nature itself protects a woman.
Can high pulse rate of 140 or 160 can also cause heart attack?
Now, up to 160, we really don't worry, because there is a natural mechanism in our body where, as per requirement, pulse rate goes up and automatically comes down. You must have seen when the person is tensed up, anxious, appearing for an examination, interview, or even a movie hall, when there is a very, very big fight going on, everybody's heart rate goes up in the movie hall. After this is over, again it comes back to normal. This is a normal mechanism where that's a part of the response of the body to fight, flight, or fright. But if it's occurring without any outside stress, without any running, without any movie, suddenly a young lady's face, my heart keeps on racing up to 160 per minute, then it is abnormal. And we have got various causes the arising from the atria, causes arising from the ventricles. It is usually an electric problem, and then we can be suppressed, check it up, and afterwards identify the source and use appropriate drugs to control that. It can be done. I don't think it is equal to cardiac arrest.
Should we do lipid profile check every year or every 6 months if the last tests were within range?
Within range means I think that everybody should aim for a bad cholesterol of less than 130. And if you are already have got a high risk group, like in your family, your aunts, uncles, father, mother, anybody has got premature heart disease, then you are at high risk. Then you have to check your lipid profile more frequently and use medication, and then follow up and see whether the cholesterol levels have come down or not. If it is normal, then we don't have to come for every young people. We don't do it frequently. As you age more and more, then it is important to check it out.
Once a time, her heart blood circulation was not proper, and pain was she was getting pain. So what can be done in such situations?
Blood circulation is not fine means I understand that the blood pressure must be low, or the heart pumping must be low. And that is why the cardiac uh, uh, output was not matching with the body's requirement. So there is a deficit between the requirement of the oxygen and the production of the cardiac output. So such people, they are known as a heart failure. So is it heart failure? There are many causes. It could be a pump problem, or it could be simply that the patient has got less blood. Maybe she's anemic, or maybe she's got a valve problem. The valves are not opening properly. So we have to check up what is the underlying problem. The causes are many. Once you identify the problem, I think that definitely we can improve the patient's blood pressure as well as cardiac output.
What are some of the symptoms prior to heart attack, apart from monitoring the lipid profile?
Heart attack, we say the premonitory symptoms and actual symptoms when the heart attack occurs and the blockage occurs. But before the actual 100% blockage of the uh, particular artery occurs, for many days this is going on. The slow choking of the arteries gives rise to lassitude, weakness, or pain, mild pain occurring when earlier it was not there. Earlier you could climb 3 flights of steps. Now you are able to flight only one climb and your one flight and you are breathless. Or a particular 3 games of badminton you used to play. Now one set you are so tired. So such rapid change in activity or episodes of sweating, episodes of giddiness, these are the premonitory symptoms. And occasional chest pain does occur, which is momentary, but if usually is associated with activity. While sitting or resting, if the pain occurs for momentary, it is not cardiac pain. And similarly, cardiac pain, which when it occurs, it's got peculiar quality. It's like a slow crushing pain, as if a child is sitting on your chest. This patient has difficulty in breathing and all that. Small little pinching pain, which comes and goes momentarily like a pinprick. It's not cardiac pain. So we know what is cardiac pain, it is non-cardiac pain, and accordingly we can act. The premonitory symptoms are breathlessness and occasional chest pain on exertion, giddiness. These are the premonitory symptoms which should tell you that something is happening. You should go for a checkup.
Palm oil is also not good for the heart. For example, in products like Lay's or any market products. So, what are your thoughts on that?
So it's not one oil which is good, one oil bad, but nowadays the processed oils made in factories, they add various chemicals to it and then try to make it more easy flowing. But what the naturally pressed oils, which are better. Now it could be palm oil, it could be coconut oil, any oil. Depends in our country. So many types of states are there. Few people in one particular state region might prefer that. So all of them are equally good or sometimes equally have got some problem. But it's good to change variety of the oils in a one household rather than to keep on sticking to one, because each one oil has got its own advantages and we should take advantage of it, either in the form of reduction of cholesterol, deposition of clot from reduction, and all such things. So it's a good thing to change your oils once in a while.
So, trans fat has become a buzzword these days. How does it affect the heart, and does it particularly affect adults?
Yes, the trans fats are the one which I was talking of. When the oil is heated and reheated, the oil becomes changed in the composition and it's become very difficult for the body to dispose it of once you have something cooked in that. So these are the things which have got to go and get deposited in various places. So in general, if you can identify the oil consumption pattern, amount of oil taken, and is it a reheated oil, we should definitely reduce it. The less amount of oil you consume, the better it's for the heart. That's known. But the allowance is 500 ml per head per month. That means it will be 1 tablespoon and 1 teaspoon makes 20 ml per day. You make your omelette or you make your chapati or whatever it is, breakfast, lunch, and dinner, everything, 1 tablespoon oil plus 1 teaspoon oil.
Is regular belching dangerous? Is it a symptom of blockage of arteries?
Regular belching is a sign that you're too hasty in eating your food, you're not drinking enough water, or your posture is bad. That's the air that you swallow with each morsel of food, or the air that you swallow when you're swallowing, chewing, or eating food, that is getting trapped, and then it keeps on burping up. Now, there are two, three reasons for that. One is that the people whose digestion power is poor, the stomach has become slow in motility. Second thing is the types of dal that is being used, excessive fried oil that produces too much gas and which does not even wait for a way all the way to go down. It immediately comes up. So I think burping is not a sign of heart disease.
So if someone gets, chest pain for 40, 50 seconds and
Hmm.
then there is some breathing problem, then could it be a cause of heart problem?
Pain and breathing difficulty are two bad symptoms to have together. So if they are occurring together, that means there is something artery as well as something air transfer in the lungs, both are affected. It could be a cardiac problem. Yes, I think the person should go for a checkup. It could be breathlessness due to blood pressure, it could be a heart problem, or due to low blood anemia. All of them come causes.
What do you think about the usage of pure ghee? Since childhood, we are usually advised that pure ghee is good for health. So,
Yeah.
what's your opinion on that?
Pure ghee, as was in at one time in good use when people were exercising. Pure ghee is immediately produce a lot of energy, and it's been used in various rituals. When you there's a festival cooking and all, we definitely would love to have something nicely tasty and smell like ghee. But those days, the people were walking from one corner of the city to another. They were doing cycling, everything. No, if you want to have ghee also, and always use a car to go and to the office all the time, not even going to walking to the bus stand, then this does accumulate. So reduce the amount of ghee, will be good for you because you're not burning it. Whereas if you're an athlete, for example, or weightlifters, cricketers, or people who are running for the country, and in a soldiers, no, soldiers, they'll asli ghee, especially in North India, they love this asli ghee. They're wrestlers. They'll eat a lot of ghee because they produce energy, but they use it up. No, when you're an office goer or when you're just sitting idly at home, if you have too much ghee, you're in for trouble.
Someone gets up suddenly in the midnight and starts sweating, and hands and body starts shaking, followed by heavy breathing or difficulty in breathing. Uh, if this happens often, then is it serious?
Yeah, there are many causes of sudden breathing difficulty as well as sweating. It could be respiratory causes also. Simple thing like as a snoring. People snore a lot and then they go into slowly a phase of low oxygen. And then suddenly they wake up at the start when the alarm bells goes all over the body. And they wake up with a big start, they sweat. Again, they go to sleep. It could be a respiratory problem, or it could be a simple thing like an asthma, attacks. Then other thing is patient at night. Why should they, when the heart is at rest, it is not asking for more oxygen. It can happen in people who are heart failure. Daytime, the fluid is all in the legs. And when they lie down with the legs up, all the fluid in the legs is coming back, flooding back into the system, and then they have breathing difficulty. So this is a kind of name for that. It's called orthopnea. Orthopnea means when lying down flat, he's breathless, and he propped up in a sitting chair, he feels better. That's called orthopnea. It is a sign of heart failure. It's given a proper situation.
What would be some of the common tests for a healthy person at the age of 40s with respect to heart?
If you are over age by 20%, because there is a big tables lay down your height and weight charts, and if you are more than 10% from here, already you are in trouble. And if you are 20 to 23%, then you are called obese. So what we should look for is obesity along with blood pressure, high cholesterol, and diabetes. All the three. So such person should check up for also thyroid. So thyroid checkup and cholesterol checkup as well as blood pressure checkup they should undergo.
Added sugar in beverages or packaged foods, could these be the cause of heart attack?
Yes, people have said that most of the time these are called processed foods. Processed foods are made for the tongue, not for the body. the processed foods vendors, they make food so that they sell fast, quick packets. People who are waiting in the bus stands, in the railway stations, or when during journey, they are for chatpata, immediately happiness. They are not worried about your health. So the amount of oils, the amount of spices, the amount of various types of carbohydrate they use, they are not worried about what your future. They are worried about their sales in that particular day, and they know you're not going to go back and hit him in case you get in trouble, because they're always on the move. So processed foods should be kept minimum, when especially when you are eating outside. Less than once a week, I think you should go for a party outside, and always be choosy. If the food is very greasy and sticking to your fingers and oil all over the spoon, all over your napkin, then it's dangerous. So reduce your processed foods. Natural foods, your homemade, are better.
What are some of the basic do's and don'ts suggested for heart health in terms of food, activity for kids, young, mid, and old age people?
We have got a very nice terminology for it. It's called lifestyle modification. In many heart diseases, it's not immediately required to put the patient on a medication or immediately go for angiogram, immediately go for treatment with bypass surgery and all such things. So many things can be tackled by lifestyle modification. Lifestyle modification includes two, three things. One is diet, like we just talked about. Have adequate caloric diet, not overeat. Number two, the type of oil that you are used and how much quantity you are using. Then exercise. Each person should walk, because this is our body is made for walking. We are standing on our 2 feet, and we should exercise as much as possible, so that the food that you have eaten is properly digested, and the legs and the hands and the bones and muscles all get good exercise. So nowadays the people have got the uh, step counter on their mobile phones. They say 4,000 to 6,000 steps every day you should have. This you can hoot in your own, around your house, or in your own apartment complex, or in a small little ground in your colony. You don't have to go all the way to a playground to run. If you are an athletic person, definitely if you run, you will be saving a lot of expense in the later years of your life. So this habit, which we call it Gandhiji's treatment. Gandhiji was so thin and he used to walk like anything, isn't it? So he stayed absolutely healthy. So the number of steps you take per day becomes very important. You will be trim, and you won't have obesity, you won't have big tummy hanging out, and your BP and pulse, everything will be checked. So exercise is important. So diet, exercise, avoidance of smoking, and avoidance of excessive alcohol. These are the important steps for every youngster.
Someone here asks, her father has blocked arteries and was told that only 20% of the heart is working. Is there something in this case that can be done? Doctor says his heart is too weak for any surgery.
This is what we are talking of, left ventricular dysfunction. The heart muscle has been weakened by gradually reducing blood supply. Now the output of the heart has, instead of being at least 50% minimum, which for all of us, is fallen down to 25%. This called ejection fraction has fallen down to 25%. We classified heart dysfunction as mild, moderate, and severe. And he falls under the severe group. At least 40 to 50% is called mild, 30 to 40% is called moderate, and anything less than 30, we call it a severe left ventricular dysfunction. Now we have got a lot of medication as well as lifestyle modification, how to reduce your workload. You can use help whenever required. And of course, excellent medications have come. Earlier, we never used to have, there was only one medicine called digoxin. Digoxin for heart failure, it keep on giving. And nowadays, digoxin is replaced by many drugs which increase the salt output. Means the excessive salt in the body puts load on the heart. So get rid of the salt by diuretics. Then there are something which in the kidney, it flushes out the kidney. So they are called ACE inhibitors. So there are many which reduce the volume of the veins. So many drugs which can definitely use. And there are especially the newer medicines which are excellent result, he should make a proper doctor, get a personalized prescription for his type of heart failure, and he'll improve.
Is walking 10,000 steps a day good for your heart?
Yeah, of course, excellent. I wish everybody can do it, but everybody can't do it. After all, you have to work, no? So gradually you have to build up. And if you got the space, if you got the time, nothing like walking 10,000, that's an excellent way of keeping fit. But you have to not, you can't start today 0 steps, tomorrow 10,000 steps. You will die of exhaustion. You have to build it up gradually, like any exercise, either in the gym or any game. You have to condition your body slowly so that your muscles pull doesn't occur. You don't stumble and fall down. So gradually you build up 10,000. If you can maintain, excellent. Even if 10,000 steps in 3 to 4 times a day is good enough.
What are some of the early symptoms of blockage of arteries?
One of them is breathlessness. Second thing is lightheadedness. And third thing is chest pain occurring while you are exercising and becoming all right. So these are the most important symptoms.
Is there any particular time gap in which first and second stroke occurs? And if so, what should be our actions with respect to that person after first stroke?
I think what they mean by stroke means heart attack, right? So in stroke, we always think of a brain stroke. So that is the brain stroke is called stroke, and heart attack is called heart attack. You don't call it heart stroke. So after the first episode itself, the patient should go on to lifestyle modification, get his heart checked up. If there are any blocks and all, he should get it removed, and continue lifelong medication with the blood thinners. Nowadays they've got excellent blood thinners. Earlier, aspirin. Aspirin is all dose, like 150 mg, half a tablet, can reduce blood thinning. We got better drugs like clopidogrel, ticlopidine, which are very, very safe and which can be taken along with the medication. And then slowly the lifestyle modification medicines, the control of blood pressure and graduated activity, you should come back to normal.
If we start breathing heavily after we do some simple work, is it a symptom of any heart problem?
No, I think it is just you're out of practice. If you don't go for a walk for 1 month, when you come back again, start walking, you feel breathless. Oh, that means you're out of your breath because you are not used to it. You slowly increase your capacity, then you will be all right. So every time you become breathless, you suddenly not think bad, something happening to your heart. So a soldier goes 2 months leave from the army. When he comes back, you can't expect him to again running 100 meters dash again. So he'll again get practice, and then again he'll become all right. So activity, too much absence will make a person effort tolerance go down. Again, he has to gradually build it up.
My husband is facing acidity and gas problem, sometimes breathing issues too. He has visited cardiologist, did 2D echo, and it's normal. But still the same thing occurs again and again. Like he is having lot of gastric problem and breathing issues. Also, he has lots of gas. So should he visit the gastrologist or someone else?
Yeah. Firstly, he has only mentioned the echo, but we also got other tests like ECG and treadmill test. ECG shows is there any damage already done to the heart, and a treadmill says what is the future likely. Supposing the patient says after walking for 10 minutes, if the heart suddenly shows it's not getting proper blood supply, then that's important for us to suspect a coronary artery disease. So the cardiac evaluation has to be completed, like ECG, treadmill test, and the 2D echo. And if everything is okay, you should visit a gastroenterologist. What they've got is a simple examination, stool examination, or examination of the endoscopy. They can look into your stomach and esophagus and see whether there is any ulcers or any erosions or there is any hernia inside the stomach. From the esophageal hernia can occur, as erosive gastritis can occur, which are making his life difficult. So first let him get cleared by cardiologist. Then you should visit the gastroenterologist to get any home treatment.
Can accumulated cholesterol in arteries be reduced by proper diet and exercise?
Yeah, these are people are keep on asking me. I've been taking cholesterol medicines for 2 years now. You think my uh, cholesterol has melted away? The blockages have gone? Unfortunately, no. The cholesterol lowering medicines are only going to stop further deposition of the cholesterol in your arteries. The ones which are already in place, already lined up your arteries, now they cannot be undone. It's like a pothole on the road in Bangalore being filled up by tar and stones. Now, by any amount of water you pour it, only the dirt will go, but the deposit will not go. So you cannot undo a block by cholesterol lowering medicines. That is very clear. Well, the block can only be removed by either balloon or stenting if its ball block is too much. If it is less than 50%, 40%, 60%, no doctor would put a stent or anything. He'll just say the artery will modify itself. It's like having a small block in your road with the which is too small. You can't call the bulldozer and take away the block because it's too small to call a bulldozer. So I think more small little blocks, they will get sorted out by the artery remodeling. But don't be under the impression that cholesterol will dissolve the already deposited blocks. No.
What does this indicate? While walking, not much, or short running, there is too much of breathing.
Yeah, that means unaccustomed. Firstly, you have to be accustomed. Suddenly one day from 1st October, I'll start running. You can't decide. You have to walk, then you have to walk longer, then you have to walk briskly. Slowly get into the habit of long walks. Then you can walk long distances or climb, run, nothing happens. But all requires induction. Slowly get into the habit. Then it will be good. You can't suddenly start one day and say, I'm feeling breathless. That's starting. Slowly you should get into it. Meanwhile, of course, before starting a very vigorous exercise, even the gym people also want a doctor's checkup, else BP should be all right.
What might be the cause, or does it indicate any issue? Especially when we get emotional, we feel a heavy heart or some kind of discomfort in heart.
Yeah, that's the part of the hormones being released. As I told you, there are many types of hormones which control a person's moods, their activities, the way of they think, everything. So these, as long as the mind is active and the person can become emotional, can be excessively happy, correct, depressed, the hormones play their role, and they all of them have got effect on the heart also. There are a group of hormones which are called the stress hormones, like adrenaline, noradrenaline. They are in reserve capsules in the body. In times of stress, suddenly they get released. Like uh, you have seen a deer, such a soft, nice animal in the jungle. Nobody would think of harming it, and it's so peaceful, and it's not running every time. It's standing in. But one roar of a tiger somewhere, and you should see the deer changes its entire shape and structure, and how it runs, how fast, how frightened it becomes. Within seconds, the hormones get released that run, they tell the deer. So in our body also, we got so many places where adrenaline, noradrenaline is stored for emergency use. Suddenly there is a big problem. We all know how to get up and run. You will get strength from where? You will get strength from the hormones which are kept stress hormones. Same thing will happen when there is the examination, when there is a push or in a queue, or there is something, somebody is attacking you, you will get the strength to fight it because of the hormones. Now, without any stress, if you keep on getting these hormones, then there is something wrong. Either the person is going through an emotional stage of life, or a lady is approaching menopause, or there's lack of blood, anemia. See, these are things to check.
I was told that laughing therapy is good for heart health. What do you think about it?
That's true, correct. There are so many good hormones. In our books also mentioned that you have to, there are good hormones, they are present in our body. You have to activate them. Okay? Like there is something called endorphin. Endorphins means that's hidden in the muscles. The moment you exercise muscles, the muscles release a substance called endorphin, which elevate your mood. Have you ever seen children get tired. They run like here, there. When they come back, they're so happy and jumping. They never look tired at all after a game football. So similarly, there are many other hormones which are hidden in the body. They say if you do a good deed, you donate some rupees to the persons who are begging, you'll feel happy, isn't it? So other thing is, supposing somebody hugs you or you hug somebody, again hormones are released which will make you feel good. So these are good feel good hormones which are welcome. And they say if you go out into open spaces, see a lot of greenery, a lovely scenery, everybody's I like that place. Why did you like that place? Because it releases a particular type of hormones which make you feel good. So these feel good hormones are to be encouraged. And if love therapy can such produce more such hormones, definitely the person that I've seen, they do it religiously and they are feeling happy. Whether it reduces the stress in the body, and thus stress related diseases also will be less.
Where can we meet you in person for in-person consultation? So Dr. Sitaram is based out of Hyderabad. You can, if you are not around Hyderabad, then you can book an online consultation with him. All you have to do is reach out to your care manager, and she will facilitate everything for you. How many liters of water should a person consume in a day for a healthy heart?
Yeah, the normal person, there is something called water loss. There is insensible water loss as well as sweating plus our urine output. This is the total. But depending on the seasons, the person normally passes 1.5 liters. That is 1500 ml goes out in the urine. Now, sweating and such other thing like the breathing, the mouth gets dry, the nose gets dry. There's water loss. So all these things put together, approximately 2 to 2.5 liters, I think, will be the adequate replacement of the fluids lost from the body. So if the person has got loose motions or if the person is vomiting, then of course the amount of fluid required will be more. But approximately 2 to 2.5 liters per day should be the intake so that your metabolism goes smoothly.
Are oats good for cholesterol? And is intermittent fasting good for heart?
Yeah, they say intermittent fast is good for the heart to get detoxified, and also it gives you the confidence that I can stay without some extra food. I'm not going to faint. It conditions your body. And as far as oats are concerned, I'm really not heard of anything which they can help the heart. Otherwise, by this time, all the doctors would be eating oats, isn't it?
So, how does stress impact heart health, and what strategies can help manage it effectively?
Yeah, this is a very common question, and we believe that stress is a part of life, but it is an emotion as normal as sadness and happiness, grief, and all these things are present in everyone. But each one has got a space. A stress is a hormone released in the body through the nervous system. And when the nervous system perceives there is a threat coming up, and it automatically prepares the body for action, fight, fright, or flight, I told you. So when your person is going for the writing an examination or appearing an interview, we all gone through that, isn't it? When you're sweating and your hands are trembling, your pulse rate is racing. But after the exams will be again cooling down. So this is a natural mechanism. On the other hand, we have got so many people who keep coming to the doctor with pains here, pain there, and I'm having bad dreams and my heart is racing. Now this is called anxiety. If you talk to these patients, I keep in touch with these people who are, I myself very curious to know why these people are not able to enjoy life when everything is, there's no war, there's no famine, you got income and you got family. Why are you so unhappy? The answer is that there's a word called anxiety. Anxiety is a normal hormone. We all feel anxious, when there is a train which is coming, not is come late, so you're all anxious. When your son gone to school hasn't come back, you feel anxious. So this is anxiety. The definition of anxiety in the encyclopedia is that it is unpleasant anticipation. Such a lovely definition. That means when you think, oh my God, something will go wrong, that is got anxiety. When you know the telephone, you are waiting, the bad news will come in, then it's called anxiety, right? So this particular anxiety, if it is out of bounds, when there's no threat and still you feel anxious all the time, you go to pieces. Your mind is tired, you lack of sleep, and you get worried about small things. You don't enjoy the food in front of you. You don't enjoy the nice things around you. The anxiety means you would have to sort out your issues, have a nice talk to your spouse or your parents, and find out what exactly is causing. Have a good friend to open up, or if everything fails, go and meet the psychologist. Psychologists are extremely good. They will trace out from your childhood days everything, and then they will trace out one particular feature that is causing you anxiety, and then they will tell you how to go about when you feel anxious. So I think this is what is my advice, that if you are not able to sort out your issues by talking to your friends, your family members, or your doctor, definitely meet a psychologist. They will help you.
My heart rate goes very high very frequently while sleeping. You can say at any time. What should I do? I have reached out to at least 6 doctors. If it is stress, then it should not happen in sleep. Is there any permanent solution to this?
Yeah. Firstly, there are certain diseases like simple things like low hemoglobin. If your hemoglobin is low, your heart rate will be higher, right? Second thing is thyroid disease, thyrotoxicosis. I'm sure every doctor would have tested for all this. And if everything is still there, I would still keep anxiety as one of the causes, and depends on how much heart rate is going on. We'll have to see whether there's any only anxiety or something else. Nowadays, we got a very good measure to check, that's called 24 hours ambulatory pulse measuring. That is pulse rate, Holter monitoring, they call it. This small little chip like a sticker they'll give you, and you put it on your chest and then go about whole day. The chip will keep on recording your heartbeat when you're sleeping, when you're lying down, when you go to the toilet. Every time it keeps on checking, and it keeps sending a signal to the cloud. And in the cloud, the messages getting recorded, and in the next day, entire graph comes. What is your heart rate at rest? What is your heart rate with activity? And then you can see whether it's getting abnormal at night, or if after too much of coffee I'm taking, too much of tea, something happening, we should make it. So 24-hour ambulatory monitoring of the ECG, called Holter monitoring. Every city has got, they'll ring up and they'll come home and fit it. And after the person will send the report directly, you can take out the sticker and throw it out.
So, what is the reason for louder breathing, which can be heard by others?
Yeah. So this is called the obstructive sleep apnea. This is when a person is making so much noise trying to take a deep breath. When all others are in the room, are absolutely silently, they are able to get their breath, oxygen in and out in the room. This person, when he's lying down flat, the tongue is falling back and obstructing the airway in the back of the throat. So that is making a big noisy choking noise, and this is so loud that vibrations will wake up everybody. Such persons, if you are there in the 3-tier sleeper compartment, the whole compartment has to wake up. So this is called obstructive sleep apnea. There is obstruction to the inlet of the air. Sometimes the obstruction becomes so much that the breathing stops. For 1 to 2 minutes, there's no breathing. Suddenly there's a big sound and the person wakes up. And I can actually make out a person's obstructive sleep apnea even before they open their mouth. When they come into the room itself, I ask them, so your wife is complaining that you are snoring. He says, I haven't told you anything about my snoring. I said, I know, you haven't told me, but I'm asking you, has your wife complained? He says, no. I said, ring up your wife. So in front of me, he rings up, dear, am I snoring too much? He says, of course you are snoring too much. This is the way you can make out from looking at the person. This guy has got a big jowls, he's got a bull neck, he's overweight, his eyes are red shot because he's not slept properly. All these things. And all the lorry drivers, when they have an accident, it is because they are not able to sleep at night because of the snoring, and daytime they are so drowsy. when you wake up in the morning, you should feel active, no? But these people who are snoring at night, they so carbon dioxide excess that they keep on falling at the breakfast table. They keep on sleeping up in the office meetings. Some people who are chairing a session, one of the doctors, after announcing the next speaker, he falls off asleep. So this I've seen. These are the features of obstructive sleep apnea. Fortunately, there is a test for that. It's called, again, sleep study, polysomnography. So during the sleep, what is happening, the oxygen, everything they check up. And there's a nice treatment for that, and that is called the CPAP, the BiPAP. So positive airway pressure, they give a mask and it's connected to machine so that they'll keep on under pressure, or air will keep on, no oxygen, simple air. And the person's snoring stops and he becomes so thankful that I want to go abroad. Can I take the machine along? I said, definitely. Go all over the world. Nobody will complain about you. So obstructive sleep apnea is a condition where your caller should be care of. Ask him to go to see a pulmonologist.
So my dad has done ECG, TMT, echo tests. Everything is done. All are normal, but he gets chest pain few times. Are these all the tests that is needed to check normal functioning of heart?
Yeah. If the ECG is normal and the treadmill is normal and the echo is normal, I think you should be very happy. But the chest pain is arising from non-cardiac structures. What are the non-cardiac structures? They are ribs. Supposing as he gets older, he's going to low calcium. Because the low calcium, the bones in the flat bones in the chest, they start paining, especially when you turn to one side and all. So this is called myalgia pain, fibromyalgia. He'll be all right if he takes some vitamins, calcium and all, get his sugar and calciums, everything checked up. I'm sure he'll be all right. No need to worry about heart disease in such people. The treadmill normal means I usually ride there fit to fly plane with 200 passengers. Means that much guarantee a treadmill, negative treadmill gives. So there's no need to worry.
Thank you so much, doctor.